Attention deficit hyperactivity disorder (ADHD) is a mental disorder of the neurodevelopmental type. It is characterized by difficulty paying attention, excessive activity and acting without regards to consequences, which are otherwise not appropriate for a person's age. Individuals with ADHD can also display problems with regulating emotions. The symptoms appear before a person is 12 years old, are present for more than 6 months, and cause problems in at least 2 settings, such as school, home, or recreational activities. In children, problems paying attention may result in poor school performance. Additionally, there is an association with other mental disorders and substance misuse. Although it causes impairment, particularly in modern society, many people with ADHD can have sustained attention for tasks they find interesting or rewarding, known as hyperfocus. Symptoms: some people with ADHD have fewer symptoms as they age, but some adults continue to have major symptoms that interfere with daily functioning. In adults, the main features of ADHD may include difficulty paying attention, impulsiveness and restlessness. Symptoms can range from mild to severe. Many adults with ADHD aren't aware they have it, they just know that everyday tasks can be a challenge. Adults with ADHD may find it difficult to focus and prioritize, leading to missed deadlines and forgotten meetings or social plans. The inability to control impulses can range from impatience waiting in line or driving in traffic to mood swings and outbursts of anger. Adult ADHD symptoms may include impulsiveness, disorganization and problems prioritizing, poor time management skills, problems focusing on a task, trouble multitasking, excessive activity or restlessness, poor planning, low frustration tolerance, frequent mood swings, problems following through and completing tasks, hot temper, trouble coping with stress. What's typical behavior and what's ADHD? Almost everyone has some symptoms similar to ADHD at some point in their lives. If your difficulties are recent or occurred only occasionally in the past, you probably don't have ADHD. ADHD is diagnosed only when symptoms are severe enough to cause ongoing problems in more than one area of your life. These persistent and disruptive symptoms can be traced back to early childhood. Diagnosis of ADHD in adults can be difficult because certain ADHD symptoms are similar to those caused by other conditions, such as anxiety or mood disorders. And many adults with ADHD also have at least one other mental health condition, such as depression or anxiety. Stimulant and non-stimulant medications. Medication is often an important part of treatment for a child with ADHD. However, it can be a difficult decision to make as a parent. To make the best choice, you and your child's doctor should work together to decide if medication is a good option. If so, ask the doctor whether your child needs medication during school hours only, or on evenings and weekends as well. You and the doctor should also determine what type of medication might be best. The 2 main types of ADHD medications are stimulants and non-stimulants. Central nervous system stimulants. Central nervous system (CNS) stimulants are the most commonly prescribed class of ADHD drugs. These drugs work by increasing the amounts of the brain chemicals called dopamine and norepinephrine. The effect improves your child's concentration and helps them focus better. Common CNS stimulants used to treat ADHD include amphetamine-based stimulants, Adderall, Dexedrine, Dextrostat, dextromethamphetamine, Desoxyn, dextromethylphenidate, Facalin, methylphenidate, Concerta, Daytrana, Metadate, Ritalin. Non-stimulant medications. Your child's doctor may consider non-stimulant medications when stimulants haven't worked or have caused side effects that your child finds hard to handle. Certain non-stimulant medications work by increasing levels of norepinephrine in your child's brain. Norepinephrine is thought to help with attention and memory. These non-stimulant treatments include atomoxetine, Strattera, antidepressants like nortriptyline, Pamelor. Other non-stimulant medications can also help with ADHD. It isn't fully known how these medications help with ADHD, but there is some evidence that they help certain chemicals work better in the part of the brain involved with attention and memory. These other non-stimulants include guanfacine, Intuniv, clonidine, Capvay. Side effects of stimulants and non-stimulants. The more common side effects of stimulants and non-stimulants are pretty similar, although they tend to be stronger for stimulants. These side effects can include headache, trouble sleeping, stomach upset, nervousness, irritability, weight loss, dry mouth. The more serious side effects of these drug types are rarer. For stimulants, the serious side effects in children can include hallucinations, seeing or hearing things that aren't there, increased blood pressure, allergic reactions, suicidal thoughts or actions. For non-stimulants, the serious side effects in children can include seizures, suicidal thoughts or actions. Therapeutic ADHD treatments. Several therapy options can help children with ADHD. Talk to your doctor about whether one or more of these options would be a good choice for your child. Psychotherapy. Psychotherapy can be useful in getting your child to open up about their feelings of coping with ADHD. ADHD can cause your child to have problems with peers and authority figures. Psychotherapy can help children better handle these relationships. In psychotherapy, a child may also be able to explore their behavior patterns and learn how to make good choices in the future. And family therapy can be a great way to help figure out how best to work through disruptive behaviors. Behavior therapy. The goal of behavior therapy (BT) is to teach a child how to monitor their behaviors and then change those behaviors appropriately. You and your child, and perhaps the child's teacher, will work together. You'll develop strategies for how your child behaves in response to certain situations. These strategies often involve some sort of direct feedback to help the child learn suitable behaviors. For instance, a token reward system could be devised to support positive behaviors. Social skills training. Social skills training can sometimes be useful if a child shows serious issues dealing with social environments. As with BT, the goal of social skills training is to teach the child new and more appropriate behaviors. This helps a child with ADHD play and work better with others. A therapist may try to teach behaviors such as waiting their turn, sharing toys, asking for help, dealing with teasing. Support groups. Support groups are great for helping parents of children with ADHD connect with others who may share similar experiences and concerns. Support groups typically meet regularly to allow relationships and support networks to be built. Knowing you're not alone in dealing with ADHD can be a huge relief for many parents. Support groups can also be a great resource for ideas and strategies for coping with your child's ADHD, especially if your child was recently diagnosed. Ask your doctor how to find support groups in your area. Parenting skills training. Parenting skills training gives you tools and techniques for understanding and managing your child's behaviors. Some techniques may include the following: immediate rewards. Try using a point system or other means of immediate rewards for good behavior or work. Timeouts. Use a timeout when your child becomes too unruly or out of control. For some children, being pulled out of a stressful or overstimulating situation can help them learn how to react more appropriately the next time a similar situation comes up. Togetherness. Find time together every week to share a pleasurable or relaxing activity. During this time together, you can look for opportunities to point out what your child does well and praise their strengths and abilities. Striving for success. Structure situations in a way that allows your child to find success. For instance, you might allow them to have only 1 or 2 playmates at a time so they don't get overstimulated. Stress management. Use methods such as meditation, relaxation techniques, and exercise to help manage stress. Thank you for watching. Please don't forget to like and subscribe to my channel, and please click on the bell so you'll be updated on my next video. Thank you. WeCare for UPH. Your health comes first.